Hello, everyone, and welcome to Shepherd Pratt's LinkedIn Live session about creative arts therapy. I'm Sama, and I'm so glad you're here with us today. We're joined by Sarah Masopoulos, a board certified music therapist at Shepherd Pratt's Baltimore, Washington campus. Today's conversation will give us a look into creative arts therapy and music therapy in particular, and some simple ways we can all use music to support our own well being. Thank you for joining me, Sarah.
Thank you for having me.
So, for those who may not be familiar, what is creative arts therapy and how is it different from traditional talk therapy sessions?
Yeah, so essentially, creative arts therapy is using the arts to work towards goals that aren't necessarily arts based. Um, and what's really different is the means of working towards the therapeutic goal. So instead of just using talk, we're using some medium of art. And there are several different creative arts therapies. And so you'd just be using whatever that medium is to work towards your goal.
So, what are the other types of creative arts therapy other than music therapy, of course?
Yeah. There's music therapy, there's also art therapy, there's dance therapy, there's drama therapy, and I recently learned while I was researching for this, there's poetry therapy.
Oh, wow, that's interesting.
I know, very cool.
So, do people who are artistic or musical are they the only candidates for music therapy?
No, definitely not. And that's one of the beauties of creative arts therapies is you don't have to be artistic, you don't have to be musical. Um, and one of the things that I think is really cool is that it can kind of help to erase that idea that only some people are allowed to make art, or you're a good musician or you're not, or you're a good artist or you're not.
Right.
This kind of does away with that way of thinking. So yeah, anybody can benefit from creative arts therapies, especially if talk therapy alone hasn't been necessarily effective.
Mhm.
If you've tried several therapists and it hasn't really clicked, or if people are maybe resistant to talk therapy, music therapy or other creative arts therapies can be a great way to um, kind of just find a different approach. And they're used obviously in mental health settings, but also in a lot of different settings, medical settings, special education, older adults. So this is really just a sliver of the populations that we work with.
Right. So we're always kind of in the behavioral health field fighting against the stigma of getting help. So have you found that people who do have stigmatized ideas about therapy can often be great candidates for creative arts therapy and music therapy?
I found so, yes. And, I'm working in an inpatient setting, and a lot of times working with patients who might, you know, see music therapy as something that they would never pursue on their own because, it's therapy and it's kind of a less well known therapy. Um, but it is really nice because everybody enjoys music for the most part. Um, so it is a nice way to have a therapeutic benefit without feeling scary and intimidating or stigmatized.
Yeah. Or do you have any moments that really stand out in your mind about how someone has been able to benefit from music therapy?
Yeah, I mean, I'm lucky in that it's something that is enjoyable. Again, people love music. Um, I think generally it's really nice for people to have dedicated time for self-expression, especially in an environment where you don't necessarily have as much autonomy as you would in your normal life.
Mhm.
Um, And yeah, I was thinking about different examples, and one that sticks out to me is a woman who I was working with who um, we were using instruments to kind of play and express the shift between being self-critical and being confident. And she sort of started to tear up and she was like, I just told myself I did a good job. And I don't remember the last time I did that. And it
Wow.
was just like a fun physical way to get into
Mhm.
something that, is sometimes more effective than just like, you need to be less critical of yourself. And
Yeah.
here's how it can be a little bit um, more physical, which can help.
So that makes me wonder how music is actually used in the therapeutic setting.
Yeah. Um, so in music therapy, there are kind of four different sections of um, interventions that you can use. One is receptive, so listening to music. Typically, not always patients' preferred music has been found to be most effective, and usually we'll listen with some sort of goal in mind, like self-regulation. Recreative is another category that is recreating songs that already exist. So I bring in songbooks that have, I think, a dozen or a few dozen songs with lyrics in them, and we play instruments, we sing. So that's recreating. Compositional would be songwriting. And then improvisational would be using instruments or your voice to kind of come up with things on the fly. So you're really just doing what you feel, and oftentimes I'll give a prompt for that. Like with that example that I gave, I brought one little instrument of many.
Great, amazing.
But for example, if and this is obviously a much distilled version, but if we were playing a shift from what it sounds like and feels like to go from angry to calm, we might play whatever angry sounds like and then play whatever calm sounds like, and shift and feel just like what that change is like. This is also an awesome instrument for
Can
people
you
who
play
have
it for us?
extra. Yes, it might help if I'm not talking. This is a kabasa.
Okay, amazing.
Yeah, and this
That
is
is
also
so interesting.
a great instrument for people who have extra sensory needs because it feels really great on your skin. So yeah, there's all kinds of extra little bonus therapeutic elements.
So how did you get into music therapy and being a music therapist?
Yeah, I studied music and psychology in college, and then wanted a career shift right around COVID. So I went back to school and knew I wanted to help people and ideally use music. So yeah, I went back to school and got my degree in music therapy specifically, which is a requirement. And yeah, everything has kind of gone from there. Completed the program. We have to have 1,200 clinical hours, pass board exams, um, and then we're practicing. So yeah, I've been
So
practicing for a few years.
amazing. So you still use talk therapy in your music therapy sessions?
Yep. And it varies from therapist to therapist and from population to population. Being in mental health, I probably use more talk therapy techniques than I have when I worked in other populations. Um, but yeah, it's definitely a blend, and for my therapeutic approach as well.
So are there certain goals like reducing stress or improving mood that music therapy is specifically effective in?
Yeah, there's lots of goals, too many to list, but absolutely reducing stress, improving mood, building social skills. We work a lot on opening up communication and just kind of building self-expression and self-empowerment. Um, and one thing that I enjoy is kind of improving just reality orientation. Getting everybody kind of on the same page, all following one beat. It can really help attune people to their present environment, attune people to their peers, to what other sounds are in the room. Um, Obviously, it's not a fix all, but it can be a helpful tool.
So do music therapy sessions usually are they usually group sessions or one-on-one or a mix of both?
Yeah, they can be a mix of both. I do almost exclusively group sessions, um, but have definitely worked with individuals. It's a mix of both, depending on the situation and the environment, for sure.
So what are some simple music-based techniques or exercises people can try on their own at home to support their own mental health?
Yeah. Um, so one technique I would give, there's a phenomenon called the ISO principle that we study and kind of teach in music therapy. And it essentially is defined as music matched with the mood of a client, then gradually altered to affect the desired mood state. So if you're trying to, work on this stuff on your own or build a playlist or something, you would want to choose a song that matches your current mood, and then figure out where you want to go to, and then gradually select songs that move towards your desired mood. And you might be looking at things like tempo.
Mhm.
If you're starting out anxious, you might be choosing faster songs and then gradually go to slower songs. You might be thinking about energy or tension level. But yeah, that's a quick and relatively easy way that you can make a playlist to kind of help you at home. That's also a technique that can be used to affect physiological responses like heart rate or blood pressure. I wouldn't necessarily recommend trying that on your own. I would recommend working with, a professional before you start to
Of
mess with that.
course.
But yeah, I think anybody can benefit from that type of playlist to affect their mood.
That's so interesting because I would always assume that you should just start off with if you're feeling down and you want to feel a bit happier or get the tempo up, that you would just start automatically with just a happy playlist.
Right. Yeah, which, might work sometimes, but also if you think about like sometimes it can be a little jarring. If
Yeah.
you are feeling really low, really depressed or low energy and you hear like the happiest, most bubblegum pop
Yeah.
song, it might be like that is too much. So
Yeah.
it's kind of getting to that point, but also kind of wanting to validate that yeah, it's okay to feel what you're feeling at that moment as long as we don't, make it a cycle and stay in that
Mhm.
in that headspace.
Would you say that tempo and lyrics play an equal part?
Yeah, absolutely. And it's different person to person as well. I know some people listen more to lyrics, some people listen more to the music and the beat.
Mhm.
But yeah, I think both are important for sure.
So how can families use music therapy together to stay connected or reduce stress at home?
Yeah. I think connection is definitely the key word there. I think I maybe mentioned before, um, preferred music, so music that you like best, has
Mhm.
been shown over many, many studies to be the most beneficial.
Mhm.
Um, so even if this isn't explicitly, music therapy, listening to music at home, I just recommend sharing music that you love with your family and inviting them to do the same because it can be such an awesome tool for just building bonds and opening up channels of communication. I know
Mhm.
that I work with a ton of patients who have a connection with a song because it reminds them of an important relationship.
Yeah.
So I think if anything, it can just help strengthen those bonds.
Amazing. Are there any do's and don'ts when it comes to music therapy for self-care?
Yeah. Again, I think the music that you enjoy is music that's more likely to help you. I think it can be really helpful to validate difficult feelings, but it can also be triggering. Music can make you feel worse. If it brings you back to a certain situation that was challenging, you know, maybe staying away from that if you know that if you know that it's going to upset you or going to make you feel worse. Um, so my advice would be to kind of stick in the vein of music that doesn't harm you, basically.
Mhm.
And not saying you can never listen to that, but maybe being extra mindful of the environment you're in, whether you're safe, whether you have someone to talk to, if you are going to be listening to stuff that could be challenging.
Right. I think sometimes, well, for me personally at least, there are some songs that I relate back to a certain period in my life
Mhm.
that if I do hear them play, it either makes me really happy or it can sometimes make you remember something that you don't necessarily want to be remembering in that moment. What do you think some techniques are that we could give people listening in today about if a song does come on that puts you in that negative headspace, what is a step that you can take to kind of get back into a more positive one?
Yeah, I would say just you know recognize what's happening and how you're responding to it. I think really being mindful of what's going on, in your head as you're listening to that music. If it feels like it's really too much and you're gonna feel unsafe or anything, I would turn it off or get somewhere. I don't know if you're in a grocery store and a song is playing, like I don't know, remove yourself from the environment if you need to. But yeah, I would say just be mindful about it, notice it, don't, beat yourself up for it.
Hmm.
It's such a natural response to have, emotional responses to music and have it bring things up. So yeah, I would just be mindful of it. And again, maybe if you need to talk to someone after that, talk to someone that you trust, or, do whatever coping skills you have to kind of work through that.
Great. So, if someone wants to explore music therapy more seriously, what is the best first step for them to take?
Yeah. So if you want to explore music therapy as, someone who wants to receive music therapy, I guess, or take part in music therapy, there are a lot of in private practice. We're not just in hospital settings, and you can typically find someone the same way you would find another therapist. So, you know, quick Google search, Psychology Today, really any of these places. Um, a lot of music therapists may advertise their services. Um, and yeah, I would just say be open, and if that's something you're interested in, you know, being open to the process. And then you can also the Music Therapy Association, the American Music Therapy Association, has a lot of good information just on all of the research behind everything that we do, all of the kind of processes. If you're interested in becoming a music therapist, or people who you think that would be a good fit for, they have information as well. Yeah.
Wonderful. Sarah, thank you so much for joining us today and giving us a glimpse into the power of creative arts therapy. Thank you to everyone tuning in. Stay connected with Shepherd Pratt for more conversations like this, and we'll see you at our next LinkedIn Live.
Thank you.